medical doctor. He's an emergency room physician, but he's also a professor at Wright State University. So he's teaching the incoming doctors. Thank goodness we have him on our side, teaching medical doctors coming through. And he's also a raw milk advocate. Mark?
Thanks.
Hooray.
Thanks. Well, so glad to be here. It's been a while since I've had a chance to speak to you guys. I think it's been years, although Jim, I see him a couple times a week in the gymnasium, and we often talk about topics and things of mutual interest. And thanks for the introduction. I am formally trained as an emergency medicine and trauma specialist. So I've been doing that for 21 years, and it's been a great career in medicine. And you know, one of the things that I've seen throughout that time in medicine is we have so much focus on sick and injured. And if you think about our Western healthcare system, it's essentially a system of being sick and injured. And if you were to add up all of the dollars spent in, pick our community of Dayton, Ohio, and you were to add the budgets of Kettering Health Network and Premier Health and Children's Medical Center and the Dayton VA Medical Center and Wright-Patterson Air Force Medical Center and all of the other healthcare assets that exist, you know, the Minute clinics at Kroger, all of those, less than 0.1% of the total dollars go toward preventative medicine or wellness. So that's how much out of millions and millions of dollars in our community actually is put forward toward wellness and being healthy. And as you drive down the street, it doesn't matter whether you're in Dayton or Cincinnati or Columbus or wherever you travel, you look up and see. I was in Toledo the other day, ProMedica Health. I go through Columbus, Ohio Health. Go through Dayton, Premier Health. Go through Cincinnati, Mercy Health. They say health, but as I tell my health students in medicine and public health, when I see nursing students, I think, and I'm going to throw this out to you, I think that's a misnomer. Because I think it should be, you know, ProMedica, sick and injured, or Kettering, sick and injured. Because you, essentially, as the patients out there, are nothing unless you're sick or injured. Did anyone ever come up to you or somebody in your family when they were 20 years old and say, we'd like to spend your next physician visit talking about how to avoid diabetes or hypertension or how to avoid thyroid disorders? I don't think, probably, when I speak to most people, no one in the room says they've ever had that discussion with their physician. No one ever asks. No one ever says. What we do in Western medicine is we like to diagnose. I like to come up, check your blood pressure, say, wow, it's high. We need to put you on a medicine. I write you a prescription, I hand it to you, you're a good patient, you take it, you go to the pharmacy and fill it. Do you ever ask, when can I stop that, doctor? No, nobody does. And you know, I watch catchy marketing schemes that healthcare does. The other day I was walking through a unit in the hospital, a nice color glossy brochure right on the counter in the nurse's station. It says free. It says something is free. A free cardiac scan. Doesn't matter who you are. You're walking by to visit a friend who's in the hospital. You take one, call the number, and we will assign you a time of convenience to you, and you can come get a free cardiac CT scan that's going to measure the calcium in the walls of your heart. So you're like, well, it's a great test. I'll go get it. It costs thousands, and they're going to do it for free. You go, you get your scan, and then someone calls you up and says, we need you to come in and see Dr. Gephart, the cardiologist. Because we need to examine you and perhaps order some additional testing. Guess what? You have now been caught in a tractor beam, and you're in. I'm the guy here to tell you that everyone who does that free test, disease or no disease, gets a call back for a follow-up visit. So you're in. You come in, I see you, I say, you know, we should really check some labs on you. Now your blood's being drawn. Then we use those labs to sort of stratify you based on tables, charts, etc. that show risk. And then you're coming in for a stress test. And perhaps your stress test is abnormal. Then you're getting a cardiac catheterization, where they go into the artery in your wrist or your groin and go up and actually look inside your heart. Now, in some cases, truly disease is found. No doubt there are patients who need to be treated, but many no disease is found whatsoever. But you're put on a medicine for some condition. Maybe you're pre-diabetic, maybe you're early stages of hypertension, maybe you have some early stages of thyroid disorder, and someone writes you a prescription. And then you just go to a chart and it says, bring the patient back every 6 months for more blood. And here this goes. You just wanted your free scan. And now you're in this revolving wheel, and every time you come in, seemingly a doctor wants to write another prescription. And honestly, that's what I see. I see people that are relatively healthy, on no prescription medications, midlifers suddenly on 3, 4, 5, 6 prescriptions within a very, very short period of time. And you know, all of those prescriptions can have interactions. They start to feel fatigued. They no longer perform as well as they did at their job. Their life really dramatically changes. So what I wanted to do with you is talk to you about some of my perspectives about Western medicine. I want to hear some of your perspectives too, because those perspectives, as a couple of you have asked before we started, I said, you know, do you teach this to new medical students? And not all medical students have the opportunity in their mainstream education to hear anything other than very traditional Western medicine. They just don't get that opportunity. Some medical schools have wonderful opportunities to learn about Eastern medicine, to learn about naturopathic medicine, to learn about more holistic treatment. Perhaps you know someone who's an osteopathic physician, and osteopathy in its infancy looked more holistically at the entire body. But even the profession of osteopathic medicine has become very, very mainstream with Western medicine. Again, it's based on illness, injury, and the presence of disease. And so that sort of frames essentially what's broken in Western medicine. So I always have to put this up. This information presented today doesn't represent the official position of Wright State University or the Boonshoff School of Medicine or the Faculty of Medicine. So what's wrong? I'll go over some of the things today. We'll discuss some of the problems. You've already heard me allude to some of the philosophy of Western medicine, sick and injured. Talk about some solutions, and then what can you do? What can you do as an individual? Not only what can you do for your own wellness, but what can you do, you know, when it comes to this whole system in our country called Western medicine. So, what problems are out there to see? Have you heard about some of the problems with cost? A little example. In the United States, a common drug, sulfa drugs, classification of drugs, used to treat some of the common conditions that exist. Urinary tract infections, very, very common, caused by the bacteria E. coli primarily, but some others. You go get a prescription for a 5-day course of Bactrim. Any idea what it might cost? If you had to pay out of pocket, it could cost you anywhere between $75 and probably $200. Now, if you are in a country, say you're on a cruise, and your ship docks at a port in a Caribbean island, say in Honduras, like Roatan, and you have to go to a pharmacy there, you can pick up the same prescription for under $3 off the counter. $3. It's packaged by the same company in the United States, except you're purchasing it in a pharmacy off your cruise ship in Honduras. So a little bit of the information there on cost. If you're in a hospital here and a doctor orders a drug for fever, like acetaminophen, and a nurse brings you 2 Tylenol extra strengths, and you administer those yourself, those are going to cost you somewhere between, say, $25 and $40 per tablet. Per tablet. Because you administered that medication yourself. Have you seen, and really close to here, have any of you driven over by Kroger? You're on Austin Landing, go across 75, you're headed west. See the new emergency department that's being built there? It is, it's called a freestanding emergency. Does anybody have any experience going to a freestanding emergency? If you go to a freestanding emergency department, and they're probably between this exit and Westchester and Cincinnati, you now have about 9 choices where you would go for emergency care. You show up there, those are not tertiary or full-service hospitals. So that's not like Kettering Medical Center or Sycamore or Atrium or Miami Valley. You come in there for some condition, or maybe your local paramedics bring you there. They have to transfer you to the main hospital. $2,000 out of your pocket. No one pays for it. Insurance doesn't pay for it. Medicare and Medicaid doesn't pay for it. Comes out of your pocket. Add that to the fact that if an ambulance took you there, you have an $800 to $1,000 bill for the ambulance from your own community, wherever you live. So if you live here in Miamisburg or Springboro, Clear Creek Township, in those areas, just about every city around, you're going to get a bill for that. So you're already $3,000 right out of your pocket. So that adds to the cost. The cost seemingly continues to rise and rise and rise. And so that system of Western medicine designed for sick and injured has got you in the system. And now the costs are incredible. And I tell medical students, one of the things that is important for us as doctors is to first do no harm. But I sort of add to that and say, first do no financial harm. Because every one of us in this room is one hospital visit away from bankruptcy. One hospital visit away. If you've had any of, or yourself or your friends, who have been put in on 23-hour observation status, does anybody have any experience with that? Did you have that yourself, Jim? And how did they deal with your bill? Did you get most of it?
I had to pay for the ambulance, but I fainted at MCL, and they put me in for 24 hours.
Many people, when they have 23-hour observation, end up having the entire bill themselves. So you have to be very careful when they come to you. And oftentimes as a physician, it's not up to us anymore. There's a biller or a coder or a utilization review specialist who comes up, and they look at what your diagnosis is, and they determine whether you are a full admission or an observation. And it also makes a difference if you've had more than one observation in a calendar year as well. So you could be faced with an entire overnight stay bill. And I can tell you, in my hospital, on the low end, that's $8,000, and on the high end, it's $30,000. So you could come in, have your gallbladder taken out, undergo a simple laparoscopic appendectomy where the surgeon takes out your appendix, does not open you up, makes a few small punctures, takes your appendix out. You may be forced with the entire bill, which could be upwards of $30,000 out of pocket, cost out of control. So that's one huge problem in Western medicine. Another, access. And accessing healthcare is really difficult. One of the big problems I see is many times, in order to receive any type of wellness care or health education, oftentimes people need to have access to primary care. Have you ever had any problems accessing primary care? Sometimes it depends on where you're at. You know, in our community right now, think about what's going on in West Dayton with the closure of Good Samaritan Hospital. So that's a large tertiary hospital. The emergency department there sees about 60,000 people on an annual basis. But clinics attached to the hospital that are part of the community in West Dayton are responsible for about 1,500 primary care visits per week. So those clinics, which provide those primary care visits, are the huge component of this issue we see with access. So what will people do for primary care? Resources will collapse. There won't be as many. So people will never have that opportunity to receive any wellness education or anything related to preventative medicine designed to keep them from coming to the hospital. So they won't have those opportunities. So primary care opportunities dry up. In addition, note that West Dayton is a food desert. So there's little to no food opportunities there. And as we discussed just before we started, one of my graduate students looked at another community close to us, just to the south of us, in Middletown, Ohio, and looked at food choice amongst people 18 through 25. So they looked at a study population of about 2,500 people. You'll be shocked to hear that an average of 9 fast food meals per week, 9, and then another 3 to half a dozen at gas stations per week. So most of their food choices were coming from McDonald's, Taco Bell, Burger King, Arby's, and Speedway. And so that's where they eat from. Now, I practice medicine in that community. We have sky-high rates of diabetes. I used to never see, other than type 1 diabetics, which were juvenile diabetics. But now I see type 2 diabetics who are 18, 19, 20 years old. That tells me as a physician that their bodies have been bombarded by sugar and high fructose corn syrup and all those products. And they have lived in almost a continual state of hyperglycemia their whole lives. And so their cells have now become resistant to their own insulin that their own pancreas produces. So it's a function almost of where you live and what's there. So access is a big problem. There's other barriers to healthcare. I think when you add cost plus access, that's probably the biggest barrier. Fear is also a barrier when it comes to access of healthcare. And that's kind of an interesting concept in and of itself, fear of healthcare. But there are a lot of people that may know they have a disease condition and they won't access it. For instance, they see blood in the toilet after they have a bowel movement. 7 to 9 out of 10 people will not come to see a physician if they see that. It can be a simple problem like a hemorrhoid. It could also be colon cancer. But they're fearful, and they don't come, and they don't have any desire to come to the physician because of the potential consequences. So there's a number of barriers. Privacy. Do all of you, when you go to your doctor's office, do you see your doctor now sit at a computer? Yep. The era of the electronic medical record is upon us. So all of our records are now, almost all, are electronic, so that they're shared everywhere. Data breaches can occur. Your medical record could be shared with some you don't wish it to be. There are often concerns about other people accessing it that you don't want them to have access to. And there are a good number of physicians who choose not to use electronic medical records. However, those physicians do not take Medicare or Medicaid. So they're usually self-pay. And many of the times you hear of concierge medicine or boutique medicine, where you actually subscribe to physician services, they will not take Medicare or Medicaid. Hence, they don't have that requirement to be on an electronic medical record. Hence, your records stay old style in that doctor's records, and they're not widely distributed or shared. So, some have concerns with privacy. There are also mandates. Mandates come into play when we get in the realm of vaccination. And so it's a seemingly endless cascade of rules and regulations regarding vaccinations. And I spent some time over the course of the weekend with people having kids, at the elementary school level, middle school level, seemingly, and a school nurse talking to her, a seemingly endless cascade of mandates for vaccinations. You name it, they want to vaccinate, and they want to mandate that vaccination. And perhaps some of you have gotten closer to the issues surrounding vaccination than others, but there's some very, very strong feelings regarding vaccination, and so some of those mandates continue. With some forms of managed care, mandates will essentially command you to have certain diagnostic procedures at certain points. Example, colonoscopies. And so if you do enough colonoscopies, you'll find disease in people. You will, even in asymptomatic individuals. But again, that's the way our system is designed. Our system is designed as a system for sick and injured. And they're looking for those cases that are out there. And I don't care, I'll tell you, I don't care what case there potentially could be. Consider vascular disease in your carotid arteries. If you study enough people, you will find a person with vascular disease in their carotid arteries. Coronary artery disease, study enough, you'll find it. So peripheral vascular disease in the extremities, study enough and you will find it. So these mandates exist, mandating that we go in under certain plans for certain procedures, etc. My own health insurance for my own family, in order to receive a reduction in our health insurance rate, mandated that we partake in a number of different tests. Me being the oldest in the family, I unfortunately had the larger number of tests that I had to go through versus a teenager or someone that age. But they're mandated. Even if you didn't want them, again, they're mandated. And I can't emphasize enough this whole idea of sick and ill. And you need to be really, I think, well-read and take an opportunity to learn more about this whole idea of being sick and ill. And think about what you need to do, because you need to be in a driver's seat for wellness of your own, of your family, whether it be your children or your grandchildren, nieces, nephews, and your friends. And there needs to be a real focus, again, I think, an increased, almost a laser focus on personal wellness. And it's a really almost to me, it's something that we just need to ingrain, especially in younger people, to think about this early, because they're the ones where things are prevented. And so they don't have to come see me. And it was kind of funny, we walked in this room, the first thing that caught my eye, this must be a Sunday school room for children. Maybe. Youth. So for an hour and a half on Sunday morning, they probably consume M&Ms and these dum-dum suckers. I think they're all nothing but high fructose corn syrup. I think that's what... Artificial colors. There's, the rainbow spectrum of artificial colors. Here, this is a disaster to even read it. Sugar, corn syrup, citric acid, malic acid, salt, artificial flavor, colors added for you. There you go. Red, 40, yellow 6, yellow 5, blue 1. Who on earth wants to eat blue 1? Who knows? I mean, but this is disease is a function of our environment. Okay? It's like your garden. Everybody have a garden? Like to garden? Green thumbs? No, you're not a green thumb, huh? Some are. I love my garden, and my chickens produce wonderful manure from my garden, and it's high-octane fuel for your plants. Just don't put it on the first year. Give it a year to cook. But in gardening, if you take care of your garden, if you keep weeds away, I don't use chemicals. I use a hori tool, a knife, and take things out. I don't put all these other chemicals like glyphosate in my garden, which some people do. They get Roundup and they spray that thing on their garden around their tomatoes. Nuts. That's just nuts. You want a surefire way to testicular cancer in men? Just do that and get it all over your hands. But this is the whole idea of we're a function of where we're at. So if a plant grows in healthy soil and its gardener takes care of it and makes sure that bad insects don't bother it and keeps weeds away from it and gives it enough water and makes sure it gets enough sun, it grows. It's a wonderful plant. It gives you great tomatoes or peppers or eggplants or whatever you want. It does that for you. But if you let weeds grow around your cabbage plant or your tomato plant, then your plant gets smaller and the fruit aren't as big and they aren't as many and they're just not as healthy. Maybe they get diseased, or if you don't take care of the soil, maybe there's not enough magnesium in it and your tomatoes don't develop adequately. So what happens when you put kids in an environment with this? And this is all they want, and they want more and more sugar. I got one brother who's got a kid, and I'll tell you what, he's going to be knocking on my door when he's about 18 years old. He's on his way to being diabetic, and I'm sure he'll have hypertension. By the way, do you know anybody on kidney dialysis? Anybody you know on kidney dialysis? I see a lot of young men in their early 20s, 21, 22, with a dialysis shunt in their arm. And I'll tell you, they're going to be hard-pressed to make 40 years old. And so, oftentimes the factor that leads people there is hypertension, uncontrolled high blood pressure. But in addition, probably sugar, high fructose corn syrup, being one of the most harmful. There's also so much sodium in a lot of these products too. So the person who eats those 9 meals in fast food, and they're going to Kentucky Fried Chicken and McDonald's and Burger King, their sodium load is huge. And there's really nothing good about any of that, but it's a factor of our environment. So if they are fortunate enough, maybe at school, or maybe a group like Weston A. Price does something, some outreach to kids, you try to teach them the right way, and they go right back to that environment. Maybe while they're at school, they learn about healthy eating habits, proper exercise, avoidance of tobacco and tobacco products, and then they go right home to it. Think about the problems with a heroin addiction right now. I can send somebody to detox, they can go away for 6 weeks, they can be clean, they get discharged, and where they go? Right back to it. Right back to it. And oftentimes, within a day or two, they're into my ER again with an overdose. Question?
You know who's teaching nutrition in school is ConAgra.
Really?
Yeah. If you go to the food shop museum, they have a big display. For kids.
Big ag. Big ag. So one of the things, we have some, that brings up, and to kind of address a little bit of that question about what do medical students get? Well, how many hours do you think medical students get in human nutrition in 4 years? So it's on average probably about 6 to 8 hours of human nutrition. So if you have any interest in human nutrition, you take an additional degree afterwards. You may go get a master's degree in nutrition, public health, some other discipline that you go do that. So there's very little time during medical school spent on nutrition. And where you can see that, go to the hospital. Try to eat the food they serve you when you're sick. It's horrible. It's horrible. It doesn't matter what hospital you go to. Now the hospitals are trying. They're trying to be competitive with each other, so they're trying to change the food, but it's generally very, very poor quality food. Very, very high in carbohydrates, but it's guided by a dietitian. And a dietitian is looking at, macronutrients, and they're trying to balance out the appropriate number of carbohydrates, lipids, and proteins for you based on whatever your medical condition is. So if you get admitted to rule out a heart attack, they're going to give you a low-fat, low-sodium diet. It's going to be horrible. You're going to hate it. Not only are you going to not like the food, you're not going to get any sleep while you're in the hospital either. And if any of you have been hospitalized, you know what I mean. Because there's a nurse coming in to see you every couple hours all night long. And after about 2 or 3 days of that, you're so exhausted, you need to get out of there. And who heals well when they're exhausted and malnourished? No one. Absolutely no one. So that's another oddity of Western medicine, and yet we still continue to do that. Another thing, I didn't put it up here, some of the problems I see, and really, when it comes to a lot of the drugs, and there's a drug for everything. And the unfortunate part of it is that most of the American populace wants a drug. They don't want to eat right, they don't want to exercise, they want to smoke, or chew tobacco, or smoke a cigar, smoke a pipe, or use some other drug or product that causes problems. And they want to come see me and give me a pill or a couple of pills, make me better, so that I essentially reset things and I go off healthy and happy and move forward in life. And it just doesn't work that way. But that's what we've indoctrinated into people, that there's a pill for everything. And of pills, think about antibiotics. horribly, horribly, horribly overprescribed. And also the food industry also there, because if you go back to big ag, you go to some of these modern chicken houses, you can see some of the movies that are on TV about that. You know, the chicken houses that have manure that's 6, 8, 10, 12 inches deep, they have 50-pound bags of quinolone antibiotics. Drugs like levofloxacin and ciprofloxacin. You may have heard of Cipro and Levaquin. So I see people who get spontaneous tendon ruptures, not on antibiotics. And spontaneous tendon ruptures can be related to the use of fluoroquinolone antibiotics. So when you do that sort of intensive farming and they cram thousands of chickens into a very small space, they don't give them antibiotics, they'll get sick. So I raise my own chickens, I do it twice a year, there's nothing intensive about it, they're in a big field and they're not squashed in and compact. But you know, antibiotics, if they didn't use them, these animals wouldn't live. So they enter the food chain and they enter us. So people will be walking, they'll trip, they'll stumble, they'll twist their ankle, and they'll blow out their Achilles tendon. And then they have to have a huge surgery to repair it. So it's like antibiotics. But in medicine, we placed a big emphasis on trying to not prescribe. But you may have seen this. There's this whole idea of reimbursement based on customer satisfaction. Anybody hear anything about that? So if you're my patient and you're unhappy, and you fill out your evaluation and say you're unhappy, that may translate in the hospital and the doctor getting zero compensation for what happened. So if you're a mom and you bring your kid to see me and you're convinced that a kid has a condition like otitis media or an ear infection, I have 3 children, they're all over the age of 17. None of them have ever had an ear infection. So they drank raw milk when they were growing up, and we did these right things for them, but they've never had an ear infection. If you think about people you know, maybe your own kids or others, many of them have ear infections seemingly all the time. But I'll tell you, it's hardly ever really a bacterial ear infection. Many times it's a red irritated tympanic membrane. Many times it's allergies like we have around here, like over the past few weeks, and pollen has been high. Sometimes it's a viral ear infection and they don't even need antibiotics. But their parents want antibiotics. So if they don't get antibiotics, that equals we're unhappy with our medical care. You're not going to get paid. So people prescribe. Many employers in medicine, if your patients are not happy, you are relieved of your privileges as a physician. So if your patients don't receive pain medication, or your patients don't receive antibiotics, or whatever their other drug Dr. Google says they need, when they come in, they're unhappy. And you may not get compensated for their time, your time, caring for them in a hospital. So that's a very real phenomenon that we deal with, is customer satisfaction. And very seriously, hospital network here in Dayton actually went to Chick-fil-A's corporate programs that they put on in customer satisfaction, customer service. So you notice at Chick-fil-A, if you go to a place like that, people are always polite to you. They always thank you. They thank you repeatedly. As soon as yes, my pleasure, you know, and as soon as you walk through the door, somebody's right there to greet you. And they want things in the hospital to be that way as well, because they want your loyalty as a consumer. And so they feel if they can afford you that same level of customer service, then you will come back repeatedly. Note, no one ever asks a physician how successful you are at, for instance, having low infection rates in an operating room. If you've had surgery yourself, did you ask the surgeon what's your infection rate? What's your complication rate? There's nowhere for you to go find it. You could ask for it, and you'd eventually get it. But that's not the kind of information that's readily available. The information that's readily available is, did Dr. X respond to your requests for pain? i.e., did they prescribe opioids to you? That's what it is. That's the information that's available and that's out there. If you have to have your knee replaced, or if you have to have a valve replaced, it seems almost intuitive that you would want to know, is this surgeon competent? Do they have low infection? Do they have low complication? People simply don't ask that. They want to know, will my pain be taken care of?
Would they tell you the truth? If you asked them that question, would they tell you the truth?
Most know it. Most would. Most that are not hospital employed. If they're hospital employed, it's a different story, because they're going to have to refer you to that inner mechanism within the hospital. And that's oftentimes, I'm glad you brought that up, because in Western medicine now, it's not often your family doctor taking care of you in the hospital. If you live in a more rural community, you may still have that. But if you lived right here, say, right down the street, Settlers Walk in that area, had a family doctor that was right maybe in the area, there's some professional buildings there, and you had to be hospitalized at Sycamore over here in Miamisburg, it would not be your family doctor. It would be a strange face that would take care of you. Hospitalist. So maybe some of you have family physicians who have adopted a more holistic or naturopathic methodology in how they practice medicine. It's not likely that they would take care of you in the hospital. So people would often find the foods you might like to eat or things that you might want to be odd and unusual. And in the Western medicine system, they would rear back and say, oh no, you can't do that. You can't eat this. You can't eat that. No, you can't. Those things are foreign to them. They don't understand, especially your food choices. Because remember, they have a registered dietitian there who's guiding what you're going to take, who likely has no knowledge of anything but really Western textbook medicine. They don't come out and think about other things in different ways to nourish your body. People I see who are oftentimes badly injured, or they're in the throes of emergency childbirth, and so I have to take immediate steps to save life or limb. But many of the other situations, you might want to ask a physician, are you on staff at the local hospital? Or maybe they have articulated an agreement with the hospitalist group at a local hospital. Maybe they're amenable to a nutrition consult from somebody other than who's on staff at the hospital. And sort of the ice is starting to be broken, so to speak, there. And where it's happening now is in some of the specialty cancer hospitals, where they're starting to think about nutrition. And so I went to a conference on food as medicine. Some of you may have seen that. There's every couple years there's a huge food as medicine conference, and I always tell my colleagues in medicine it's the greatest thing to go to, because not only do you learn about food as medicine, you eat the most wonderful food the whole time. And it's unbelievable. I've never seen anything like it. And you have hundreds of people attending a conference, most of them learning stuff that they've absolutely never heard of or seen in their lives. And then they get to actually go eat it. And we had hands-on labs where, you walk into a room like this, there's a big table in the center, and there's 25 mixing bowls and different ingredients and greens, and you use all those. And these people teach you these recipes. And there's Rebecca Katz. You maybe have seen some of the books. She does a lot on cancer diet. And it makes a lot of sense. So you start to see some of these big cancer hospitals are now starting to incorporate what people like, Rebecca Katz have put in a cancer cookbook. I have it at home. I should have brought it so you can see it. It's a wonderful cookbook. But so you could actually see that. They're actually doing that. That's clearly not come mainstream. If I go in the waiting room in my own hospital, there's a pop machine in the waiting room. It's got 36 slots in it. So there's, all these rows. What do you think's in most of those rows? Mountain Dew. Mountain Dew.
Oh my gosh.
There's like 1 or 2 slots with water. And I never see anybody choose water, ever. They choose Mountain Dew. And that's, they come in, the patients come to see me with severe abdominal pain. eating Cheetos and drinking Mountain Dew. And I ask people, tell me how bad your abdominal pain is. Severe, doctor, 10 out of 10, it's horrible. That's the number one complaint. By the way, in the emergency room, number one complaint, abdominal pain. All ages, across the spectrum, abdominal pain. Now, once you hit about 50, you get abdominal pain, you're above that, there's bad things that can happen. As age goes up, risk of some catastrophic things goes up. But 20s all the time, 20s, 30s, and most people, I asked this girl the other day, what is your daily food intake? She says, doctor, I eat 1 large bag of Cheetos or chips, and then I have 4 or 5 liter bottles of Mountain Dew. So I'm sure if you went in...
Are you the first doctor to ever ask her what she eats?
Probably.
Yeah.
Probably. And it's part of, is where I stick it in, and I teach medical students part of their social history. Because in your social history, we ask you alcohol, we ask you tobacco products, we ask you drugs, we ask you about sex, nobody ever asks you what you eat. And what a novel concept of what you eat may be reflective in the condition you present with. And so there's this huge number of people that they get lumped into this sort of junk diagnosis called irritable bowel disease. And you'd have irritable bowel too if you ate a bag of chips and 5 Mountain Dews a day.
See, we all know that that's bad, and everybody knows that that's bad, mainstream. What kind of irks me is that there's people trying to be healthy, so they're eating low carb, and they're eating low fat, and they're really trying to be healthy, but the big ag and whatever powers it be, even in magazines and on TV shows and stuff, they're saying that's the healthy way to be, and people are getting sicker and sicker and sicker eating that way.
I agree. And there's so much, I think there's so much external influence from all of these different factors. If any of you have paid attention to, Congress jousting over the Farm Bill recently, if you really dig into that thing and look at it, what a disaster. And there's so many special interest issues that have been, inserted here, insert that there, and there's so many riders that are attached to that piece of legislation. I don't see how it's really even a farm bill. You've got things on any number of other topics, but the power of big ag is immense. I think big ag from an influencer is more powerful than big pharma. I think it is. And my opinion as a medical doctor is problems exist because of what goes in people's mouths. What they put in their mouths, what they unfortunately put in their veins, what they choose to put into their bodies is where their problems exist. And it is just, the whole nutrition issue is immense. I see more smoking, by the way, in teenagers now than I've ever seen in medicine. I see more smoking, and it's early again. It's 9, 10, 11, 12 years old smoking, and so it's pretty. And see, I don't know why they do that. I do not know where they do that. But again, that's sort of part of that vicious circle that they're in, where they have poor nutritional choices. And the human body is pretty amazing. It can withstand quite a bit. And usually what happens is people beat it up for about 25 years until they start to wonder, maybe something's not quite right. Usually it's not until about 25 to 30 that they might run into some issue that suddenly wasn't there before. And certainly by 40, if they beat their body up, they run into some issue, whether it be cardiovascular disease, early stroke, some surgical issue, or, it's just generally feeling terrible. Generally feeling terrible without a true diagnosis. Your doctor would call you malaise and fatigue. But generally feeling terrible is responsible for billions of dollars in economic impact in the United States. So really feeling terrible is excessive fatigue, poor sleep, joint pains, low back pain, knee, hip, and shoulder pain. It's associated with all that. And as we age, it becomes issues related to dysfunction of the gut. You know, the person who drinks Mountain Dew and who eats bags of chips and Cheetos and other snack type foods like that, if you were to go in and biopsy their small intestine, it would be about as smooth as possible. I don't think there's any villi height whatsoever. And have you heard that, you know, the more you hear and the more you listen to some of these topics of nutrition, you know that you want the inside lining of your small bowel to be like shag carpet. So if you can think back to high school biology, when you look at a cross section from a microscope of the human or small bowel, you want these like fingers that stick up. So you want this absorptive surface area. Poor diet, meal choices that are poor, low quality food. If you can even call Cheetos food, it's just all synthetic and color. That's all it is. You know, pop, bad choices, it all impacts that. Certain drugs also impact intestinal villi height. So if you get those aches and pains because you have malaise and fatigue and you're chronically just ill, and you do things like listen to what it says on the TV, you know, where they're bombarding you with another choice for a non-steroidal anti-inflammatory, you go out and you take it. Non-steroidal anti-inflammatories are notorious for doing bad things to your gastrointestinal system. So, you know, you can do those things. If you are, you know, someone with celiac disease, you're gluten insensitive. I mean, I don't have that, but I just try to very much limit gluten. I would call myself gluten super, 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 super light. I might get a little of it, but, you know, my advice a lot of times, if I get the time to talk to them in an emergency department, and I'm trying to give them some idea, first thing I tell them, first thing I say is, out with the gluten. People eat so much bread. It's just the American way. You know, you show up at the restaurant, what do you get? You know, it's brought to the table right away. Here's a loaf of bread. And everybody's cutting it, and they're going at it, and they're having it. And they have a lot of it. And, you know, then you have, you know, maybe at lunchtime you had a sandwich, and at breakfast you had a breakfast sandwich. Or you go to Italian food and you just load up on pasta. And I'm like, cut out the gluten as much as you can and get rid of bread. You'll make a major improvement simply by doing that. And I say cut out the other bad actors like, you know, Mountain Dew and processed food. And oh my gosh, if you can just eliminate some of those things, you have gone and taken monumental steps toward a healthier self. There's different type of bread and there's different type of wheat. Here in our country, big ag, really essentially, wheat has changed. It's not wheat that was around 2,000 years ago at all. And a lot of those are unleavened types of bread and things of that nature. But, you know, from the Western diet perspective here, that's one of my, you know, initial areas to tell people to really avoid. In order to have better choices there, you really have to work. I mean, you really have to work at it, and you can try and find. And I've seen some things where people have tried to, you know, those who are involved with plants and the science related to that have tried to go back to the wheat, which was around 2,000 to 2,500 years ago. That's
They call that I-corn.
yeah. So it's difficult,
Because what it
but
is the chromosome, the new wheat has like 49, and the old wheat is 19, so our body doesn't have any of that extra.
but we've, you know, that comes under the fact that we've genetically modified everything. You know, I mean, absolutely everything we've genetically modified. I'm a beekeeper. We've genetically modified the honeybee. Colony collapse disorder and some of the other things that exist is because the honeybee has suffered the same genetic modification that the chicken has. You know, the Cornish chicken that most people buy at Kroger's, it's like the unchicken. And I don't know where you get your chickens. But that's I mean, you can feed it the right way and be better, but most people wouldn't want to get, I don't know, you know, I've raised some of those Red Rangers before, and people have, you know, it takes a while to get them there, and people look at that when you give it to them, and they're like, it doesn't even look like what I want.
You have to charge $7-8 a pound because of the
Oh yeah.
feed and all
And they take 12, 14 weeks to feed out. So the modern chicken, though, in these big processing places, it's just like I call done chicken. And but people wouldn't view some of these other heritage breeds. They think, well, you know, that looks more like a wild pheasant or something, and it actually does. It looks, some of these other breeds, and you just wouldn't, you know, your grandson wouldn't just be happy picking up a leg from that thing, because it would be a little tough to him, even when it's 12 weeks old or something like that. But we've modified everything. We modified honeybees, and there's some people doing some great research there, and in our state right here, where they're going out and capturing wild bees. They're capturing drone bees from wild bees, and then they'll bring them back into the lab. They'll extract semen from those drones, and they'll inseminate queen bees. So these are survivor bees that are essentially wild honeybees. When all of us in this room were young children, there were wild honeybees. They were, we all did. We stepped on them, because you were like walking through your grandparents' yard and you stepped on them. There were also clover in the yard. We didn't nuke our yards with every kind of chemical. And so you stepped on these. Those were wild bees. And I first started keeping bees in the early 80s. There were no tracheal mites. There was no such thing as Varroa destructor, the mite on the surface of the bee. You didn't have to worry about hive beetles. You didn't have wax moths. You didn't have all these other issues. And you didn't have bees that succumbed to that. And bees were strong in their hive. Nothing got in their hive. They sealed it off. And then what we started to do is we started to develop a different kind of bees. See, the genetic modification of the honeybee was we needed the honeybee to pollinate. So we had bees, which we started out in Florida, and as the season went on, they gradually worked their way north. And they pollinated different crops. They hit the orange blossom crop, then they hit the peach crop, then they hit the almond crop, then they hit the apple crop, then they hit the cherry crop, and they just went all the way north. And that's what they did. When they were done, they didn't need them anymore. They could throw them out. Versus having a honeybee colony that lived year after year after year. So when they were done up there, they were already started down in, Florida, making new hives. So our queens had no longevity to them. And over decades, they became less and less able to deal with external influences or impacts. So we modified our honeybee just like we modified the chicken or the turkey or beef or sheep or hogs. Any of those things, we modified them. And one last bullet on honey, because it's a tangential topic. If you go to the store and buy honey, it can be up to 40-45% non-honey. Karo syrup. It may come from China, but it's not all honey. So the only way you're going to get real honey is to find a local beekeeper who's a good source of honey and get it from them. So I had 600 bottles last year. And
Oh my goodness. Even if you purchase like 100% raw honey from a store, that can be.
I would say typically the ones that are marketed with the larger manufacturers or the brand names from an individual store. I know you can go to Kroger and they'll carry some local beekeepers' honey. They usually have a stand out at the end of an aisle it'll be there periodically, but usually honey in Ohio is taken off usually in July, so early July. So if you're looking for local honey in, say, March, April, you're going to have a very hard time finding it unless you bought a couple extra jars and put them in your own pantry. You might find it difficult. But in the fall, you'll probably find plenty of honey, plenty of local honey. And there's some good sources. There's some places down in northern Kentucky that if you need large amounts of honey, you can buy it by the gallon down there. And it's unpasteurized raw honey. It's just straight from the hives. I don't call mine organic. I haven't done that to get this certification. But where I live, I don't have much big agriculture near me. And I don't treat my bees with anything. If they die because they're a weak hive. And that's it. That's all I do. I try to select the fittest bees I can.
Vaccine status and HIPAA.
Mm-hmm.
So how is vaccine status not under HIPAA? Because it seems to be the vaccine status seems to be like somehow exempts them.
So the influences, the external influences on our legislators. And that's the simplest answer there is. So if a special interest group wants to lobby politicians, they will do so, and they will change the law to reflect what they want. That's what happens. So when you have almost everything else in healthcare covered by something, and you wonder, why isn't this? Special interest has gotten to our legislators who have rewritten, or when they originally author legislation, they change it or adulterate it so that it's not in there.
And do you see vaccine injuries coming in through the emergency room?
Not so much in the emergency department. I think, some specialists might see that, especially as, kids pop up. But, when I think of vaccines, you look at like the spectrum of autism disorders and such, they weren't around 40 years ago. They were not around 40 or 50 years ago. Many of these conditions weren't around 40 or 50 years ago. They just weren't there. So, when we were children, or certainly when our parents were children, there were not issues with the whole spectrum of autistic disorders, the attention deficit and hyperactivity disorders. They weren't there either. So I think what I said to you, a lot of it goes back to this stuff, what they put in their mouths, watch children eat. Watch children eat. We had a graduation party this weekend at our house, and I watched somebody who had an adopted child. So the couple who adopted the child are both morbidly obese. Morbidly obese, body mass index over 40. So they're clinically morbidly obese. 2-year-old girl, very slender. No external body, no extra body fat whatsoever. And that will be that whole environmental impact, because we watched what they fed her. They had bags of M&Ms. They weren't taking her to, a buffet line that had raw fruits and vegetables, nothing like that. And most kids would turn up their nose. My sophomore daughter gets to college, and she's like, this food here is horrible. I can't eat it. So we have to buy this extra meal plan so they can go to a special dining hall where actually at Miami, for a price, you can get better food.
Really? I know where my son's going.
But it's not in the general meal plan. It's not in it's the meal plan plus. So you have to get the meal plan plus, and it's the plus, and then they get more choices. They can go gluten-free. They can have vegan food. They can have, there's a whole palette of different things they can choose from.
Well, I'm in the thick of this. I have an 8-year-old.
Mm-hmm.
So I'm, we're going from private school to public school this fall, and
Yeah.
all this is weighing really heavy on me.
Yes.
And it just kills me how people are giving their kids blue food like that, everywhere we go. And I have to be the mean mom and say, no, you can't have that. And people think, oh, it's just cavities. Cavities are an indicator of so much more. It's just the tip of the iceberg.
Mm-hmm. And there are dietary saboteurs out there that will work so hard against all of you in what you try to do for other people. If you try to, especially with children, you're trying to give them good nutrition sources. You try to get things that are healthy for them, and they go to their friend's house and they have the bucket of M&Ms or the dum-dum suckers, and it does things to their brain. Yeah. Oh yeah.
So is there this secret community of doctors of like-mindedness like you that, don't push the drugs and push the nutrition and...
Now, where do we
I'll tell you this.
Where do we get the inside knowledge, right? I didn't realize that I was so privileged. My family doctor was really more homeopathic style. He just recently retired.
Mm-hmm.
He was also certified, and he's MD, but certified in functional medicine.
Yeah.
And you talk about, I not only had to write out papers of what I ate, I had to record what I ate for a week
Mm-hmm.
when he took me on as a patient.
Mm-hmm.
So, and then on top of that, he practiced acupuncture as part of a treatment for when you have problems.
Yeah. You just have to,
Unicorn is gone now.
you have to work hard to find those people. And typically,
I fell into that.
typically that kind of physician is sort of a hybrid that, you know,
Took regular medical insurance.
because that's what a functional medicine physician is.
Yes.
If you look at functional medicine physician, they'll take Western medicine, but they'll use parts of Eastern medicine. They all have different sort of interests in what they do, but they won't practice traditional Western medicine. Most of them will also not be hospital owned. So if you're a doctor that works for Kettering Health or Premier Health,
He was not part of the Kettering Health, it was Providence.
yeah, so the doctor for one of the big systems, say you come to see that doctor and your blood pressure is up, and that doctor says, you know what, would you be willing to take a 90-day period of time and let's work on things like weight reduction, increase exercise, if you're a tobacco user, eliminating that, and let's take this time to try to do this without medication. You, of course, but if you're in the health system and you come forward with high blood pressure or your blood sugar's a little high, I know that if you're a motivated patient, I could get you to do things to improve your health. I know we could make an improvement in your numbers, which would be good. But the system is designed that if I counsel you on that, you agree to do it, and you go away, and you're going to come back every 2 weeks for my nurse to check your blood pressure, somebody in corporate is going to be looking at my chart and saying, you didn't prescribe her an antihypertensive. Call her back in, doctor. This is a warning. They want me to give you a pill. They want me to give, so then you go to CVS, fill your 90 days, and automatically you get a little text on your phone, we're renewing it, and you're on hydrochlorothiazide until whenever. You know, most of my colleagues, most of my physician colleagues, very few of them, I don't take any prescription medicine. I'm 51. I've got a lot of colleagues who are between, say, 40 and 70, and they take no prescription medicine. And I mean, you know, I can look on here at everything, and it's just dangerous. I don't want to take it. And you know, people have some untoward reactions to one medicine. You know, my gosh, if you have any family that's in an extended care facility, they'll usually be on these huge lists of medication, 10, 15, 20 different medications. So, you know, that's horrible. So I think for everybody, it's you know, you just kind of have to do your homework, be involved in a community like this where you can hear about resources and you can avail yourself of those people because they're out there. And usually, you know, some of the people I know, I have a friend in Arizona, the thing with her practice, advanced practice nurse practitioner, she's got a 6-month wait time to get in as a new patient. So popular. Leaves a busy mainstream cardiology practice and decides I've had enough with this modern medicine, and just totally changes. Goes into, you know, holistic wellness-based practice, you know, incorporating some functional medicine. We've already said lots about reliance upon drugs. Little to no emphasis on nutrition. Very little. Think about it, you know, yourselves. Think about the next time you're in the office with the doctor. You know, no emphasis on nutrition. And they really don't understand food as medicine. You know, I'll be pro honey again since I'm a beekeeper. And if you get a sore throat, you should have raw, natural honey in your kitchen all the time, never pasteurized. You know, tablespoon in the morning, tablespoon in the evening, twice a day for 5 days when you have a sore throat. Honey is antibacterial. It is antiviral. It is antifungal. You can use it. So I don't go take antibiotics when I get a sore throat. Most sore throats, over 95% of them are viral anyway. It's adenovirus or, you know, whatever circulating virus is in the population. Most people want an antibiotic for it, and they go get a shot of a penicillin, or they get put on a drug like clindamycin. By the way, clindamycin is wonderful at killing off all of the good flora in your gut. Okay, and allowing you to get, you know, the inappropriate use of antibiotics, it leads to another condition, diarrhea. C. diff, Clostridium difficile enterocolitis. So it allows unhealthy forms of organisms, microorganisms in your gut to overpopulate. And not only did you have what was a viral illness like a sore throat or an earache or a common cold, now you've got an upset stomach, bloating, diarrhea, and you ache all over your gut. So that's what happens a lot of times when you get antibiotics that you don't need. But there's little to no emphasis on nutrition. And I bet you if you really want to surprise your doctor, ask them, well, what kind of dietary choices should I make because I have this condition?
I know a couple friends that have cancer, and I said, well, did you cut your sugar out? Because that feeds it. Oh, I asked the doctor, and they said sugar doesn't have nothing to do with cancer.
They give them candy in the chemotherapy rooms.
But, we give our patients, thinking post-operative patients, they get, hyperglycemia does not lead to wound healing. It just clearly doesn't lead to wound healing. So, but there's no healthy choices offered. I sometimes in the physician's lunchroom, they'll have what they're serving to the general hospital population. So the other day they had some kind of like turkey substitute. I don't know. Maybe it was once a real turkey, but it was wrapped around a giant hunk of dressing-like substance, which had gravy on top of it, which probably had a lot of wheat in it. And then it had a scoop of mashed potatoes with that, and it had more gravy on that, and then they had some kind of candied something. This sounds like a lot of American Thanksgivings. And you can, by the way, you can have a wonderfully healthy, fabulous, great, awesome, totally different looking Thanksgiving. You can still have some of the things that you like at Thanksgiving time and not have meals like that. But that was the general meal going out. I don't know how many calories it was. I'm sure some dietitian worked quite hard on it to make sure it met the macronutrient and micronutrient requirements. But it just, the quality of the ingredients is horrible. And so that's what goes out to people. And my colleagues still can't understand why some people don't heal. They just don't understand why they don't heal.
Oh my gosh.
They don't heal. And then they go home, they go home after a C-section, and I do see some of those complications because those ladies come back in where their wound will open up and become infected. And I ask again, what have you been eating? Mountain Dew and Cheetos. Mountain Dew and Cheetos. And, there's a disease in Western society that exists that didn't exist 100 years ago, and that's diverticular disease. So when we cracked the hull off wheat, we introduced an essentially low-fiber diet. And so for years, what we do as Americans is we pack low-fiber material into our guts, and it's pushed through like concrete sludge. And that constant intraluminal pressure on the walls of especially our large bowel leads to outpouchings, which are called diverticulums or diverticuli, and those get infected. And so when they get infected, the dangerous part is they can rupture and burst, either microperforation or they can completely rupture. Then they spill contents of your large bowel in your peritoneum. You get peritonitis and go in shock, and you can be very, very ill. But it's because of that low-fiber diet. And now we roll the clock back in an individual's life to the time that they're going out and about and they're eating things, and this is what they're eating. They're eating this and Cheetos and drinking pop and having lots of low-fiber foods in their diet. And it's taking a great toll and great impact on them at a very, very young age. So oftentimes, nobody's telling the mom and dad when they bring that child to the pediatrician's office or to the family doctor's office anything about nutrition. And oftentimes, most of those people that come in to see you are consuming those foods when they come in. They are consuming those foods. They put a McDonald's right across from the hospital. Does anybody in the room remember when Miami Valley had a Wendy's inside the hospital? What a way. Let's say sick and injured. If I was a cardiologist, I'd say, everybody, yay, just go have a Wendy's, Go have a fry, go have an extra large pop. Well, actually, they have a Diet Coke. So they make them want to eat more food there and get a triple and then go back for another fry. And then, I should just give you my business card and say, I will be putting a stent in you sometime here in the near future. And one of the biggest things, one of the biggest problems I see is we fail to understand this big world of microbiology. But we fail to understand microbiology. Doctors, Western-trained physicians, see microbes as the enemy. They're the enemy. And they're meant to have antibiotics used to treat them. Here's an example. Pneumonia. Maybe some of you in the room have had pneumonia before. If you were a group of medical students, I would tell you, the top 5 causes of pneumonia, all types of pneumonia, viral, 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 viral. Antibiotics work against none of those. But what do? You come in the hospital, we now have mandates put in place so the hospital gets paid. So Medicare and Medicaid, CMS, Center for Medical Specialties, CMS says if you're diagnosed with pneumonia, the clock starts and you've got to have antibiotics within 2 hours or nobody gets paid. So what I now have to do is have the nurse stick an IV into you and we give you a couple antibiotics through your vein within 2 hours. Note, viral, 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 viral. There's nothing to treat those, but we give you antibiotics. You get admitted to the hospital, you get antibiotics 2 and 3 times a day just like that for 2 or 3 days. You get a horrific case of diarrhea, bloating in your abdomen, you feel terrible, no sleep again, you eat poorly, and then they say, "Whoa, your x-ray looks better, time to go home." And now you feel worse than when you came in.
And now you go to a skilled nursing course first, right?
You could.
At least they do my mom.
You may need to. You may need to. And so that's what goes on. So there's this just mandate to use drugs and antibiotics. And then, you spend weeks recovering from the situation you were in. I think a lot of it needs to go back to, rather than mandates being placed by Congress on what physicians do, physicians now need to be able to treat illnesses rather than being told how to do it cookbook style from someone who is an attorney who sits in Congress. Where,
The government getting a kickback.
well,
All the pharmacists.
I'm sure that there's certain benefits that others receive for lots of what's done. I know the hospitals will receive benefits, certain ones. There's, use certain numbers of this product or that product, you get a cut rate, etc. Because they're businesses. We often joke in medicine that there's a lot of 20-somethings with MBAs that control everything, and oh, how true that is. Oh, how true that is. And that goes back to what I said, in the beginning of our talk tonight. It's not health in Western medicine. It is not health. It's sickness and injury. It's sickness and injury that drives big business. Sickness, conditions like atrial fibrillation. You all see commercials for it all the time. That is a $4 billion industry in the United States. It doesn't it? Yes. So atrial fibrillation is abnormal irregular heartbeat. So it's essentially an irregular heartbeat. And in the right atrium, and the beauty of the way our heart muscle was designed is cardiac muscle cells are said to have automaticity. And remember from high school biology, there's cardiac muscle, skeletal muscle, and smooth muscle. Smooth muscle, for instance, lines our gut, lines our blood vessels. Cardiac muscle in our heart, skeletal muscle in our skeleton, arms and legs and back, the muscles we use there. Of all those 3 types, the cardiac muscle has automaticity. It can beat without external control. You can disconnect the brain from the heart and it will still beat. So you have specific areas in the human heart and in the mammalian heart that generate the heartbeat. In some people, multiple spots generate the heartbeat. So then the right atrium beats irregularly, as do the ventricles. So it's not a lub-dub, 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 lub-dub. It might be. And you know it yourself. If it does that, you'll feel this. If this ever happens to you, you'll be sitting there in bed and you'll be like, something's not quite right. And you can sometimes hear it and you can sometimes feel it because hypertension oftentimes accompanies it. Blood pressure will go up very high and your heart rate will go up very high. So it's very common. Now what the ultimate cause of it becoming more common is, I'm not quite certain. But lots of times when I go back to what it is I go to that nutrition right there. I got to believe it must have something to do with it. Could it be electrolytes? Could it be structural design or structural ways that individual cells are designed? Could it be a proliferation of abnormal tissue? It's something going on, and for some reason it's happening. One other thing on nutrition, and I will tell you this. When I was a medical student, I spent, 1993, I spent about 4 months on external rotation at the coroner's office in Montgomery County, Ohio. I did a lot of autopsies with pathologists, got to see a lot of people on the inside. And there's a striking difference with people on the inside then versus now. So 20 years ago, 25 years ago, then versus now. So what I mean by that is because of, and I'm dead certain it's high fructose corn syrup. I'm dead certain that it's this, is people are fat on the inside and fat on the outside. Okay, normal human kidney is going to have about 1/2 inch to 3/4 of an inch of fat around the human kidney. That's the way you were designed. So that kidney essentially sits in a protective area in your Now we're seeing 1/4 of an inch or more in areas. So the poor nutrition that Americans are bombarded with on a daily basis not only impacts them and their anatomy externally, but it also does internally. So that's a huge difference. That's one of those differences we see now that we didn't see then. And that sort of internal fat that is now being packed on individuals is very much implicated in pathology, in abnormal process, in disease and illness. Yes, ma'am.
In the China study, they said it was from eating animal meat that caused that fat. What's your take on that?
Well, I'm a consumer of animal meat. I am just a wise consumer of animal meat. I'm selective in my sources, okay? There's low-quality animal meat. And I think low-quality animal meat is implicated in disease. And I clearly draw a distinction between low-quality and high-quality meat. Are you a consumer of, organic grass-fed, beef, or are you a user of whatever Kroger throws down the line, or whatever some of these smaller stores, these tube beef and terrible things like that. So you need to make a distinction in the quality of meat. Do you buy your poultry from, the local small poultry farmer, or are you buying it from Big Ag that comes from Tyson? It's a different piece of chicken, one versus the other. So being selective in your meat choice, I think, plays a big deal into that. But I think surely from calories in, it's going to be from sugar and sugar-related products. It's the high fructose corn syrup that's just omnipresent. Consumption of pop, sugary beverages. I still see the moms bringing the kids in with the baby bottle. They're also getting Mountain Dew. They can't understand why their kid's irritable and won't go to bed. But yet they're giving it.
Mountain Dew in a bottle?
Mountain Dew in a bottle.
Where are you practicing at?
Civic, that's Middletown, Ohio. And they can't understand. They bring their kids in. They're like, this kid will not sleep. Go back to that question. Tell me, the past 24 hours, what has your 3-year-old had to eat and drink? And, they'll look at you and like, they've had 2 hamburgers, a bag of chips, fries, and you're like, what they have to drink? And then they'll be like, 3 or 4 Mountain Dews. That's what they had. Also, why are they getting sick and dehydrated? I can ask these people, when did you have your last glass of water? Or when did you eat your last vegetable? Okay, here we are. I asked a girl the other night, when did you have your last vegetable? She, didn't know what a vegetable was. I said, something green. What's that? I said, how about a green bean? Well, I've never had one of those. Okay, how about a cucumber? What's that?
Wow.
I don't know. Some other girl goes, well, I think you had like a pea. Is that a vegetable?
Wow.
Well, she's like, I had peas at Thanksgiving.
Wow.
That's reality. That's reality. So, That's kind of like the tip of the iceberg. Western medicine, nutrition doesn't really incorporate it. Western medicine, driven by a bureaucracy related to lots of money, use of pharmaceuticals. So, you know, as an individual, you're charged with trying to make healthy choices, becoming more educated, being a participant, here at Weston A. Price. Read, look at sources, avail yourself of the internet, go around and see the farmers, take the opportunity to tour farms, and see what's going on. It doesn't matter whether it's somebody who raises chickens or bees or raspberries or whatever they raise. Go look around and see what's out there. Because there's a number of people who will have those healthy alternatives that you can purchase and you can incorporate into your family's diet. And everybody needs to be a gardener. Try it. For those of you who don't, it's not that hard. In a very small space, you could be amazed what you can grow. If you live in the suburbs, a lot of your suburbs now allow you to keep a couple chickens. You can have your own eggs. You can find, good sources of food for your chickens. I like chickens because chickens eat everything there possibly is. So, they'll eat extra stuff out of your kitchen. They love the tops of strawberries. I just was at Tractor Supply the other day, and they have these nice boutique little chicken houses that are all safe, and you can put them right in your backyard. Your neighbor just won't want you to have a rooster.
Do they smell?
Not if you take care of them that way. Lots of them might smell. They might smell to something that your neighbors wouldn't like, but I've got like 18 chicks in the garage right now. I keep them clean. They're real little, so they're going to go out.
I'm just going to buy his eggs.
They're going to go outside. Yeah, you can find somebody else and buy their eggs. But mine don't smell. I mean, they're in a chicken house outside. You take care of them.
My neighbor was complaining about my compost.
Yeah, and a lot of people will. People who try to have bees, even though a good friend of mine in Bellbrook was instrumental in getting the city council to allow people to keep bees, there's a lot of opposition to bees in many areas. But what I tell people that where it's legal and they do it, I'm like, don't paint your beehives white. People notice beehives that are white. Go all natural. Buy a stain that doesn't have volatile organic compounds in it. Use that on your bees. Put it out in your garden. People won't even know what it is. They don't know what it is. But they'll know that white painted beehive that they see. But if it's natural wood color, they won't know what it is.
Right.
They won't think that's a big deal. They'll think you're raising butterflies or something. All you have to do, the secret of bees is you have to just point their hive in the way you want them to fly, because they fly a beeline. They do. Because they go out about 50 to 100 feet, and then up they go and away they go. So you can stand 50 to 100 feet in front of a beehive, and they won't hit you. Because you can watch them. I could stand there and watch bees. They're coming right at you, and then they go up and away, and out they go. Each bee, by the way, goes about 3 miles away looking for stuff. That's how I can tell you. My bees don't have corn or soybeans anywhere near them. They're not going that far. They got plenty of other things to do before they would have to fly out 5 miles away. My friend, who lives about 5 miles from me, he had 300 hives last year. He lost 60% of them.
You got your wildflowers grown in the yard?
So I got all kinds of wildflowers. And our this year, the black locusts that are flowering now, that's our primary honey source. That's our primary nectar flow around here. So it's going there. It's a little late because of the way the weather was. But we'll get into a time in summer where we don't have a lot flowering, like mid to late June, July. But then in August, our weeds start to flower again. So if we have a wet late summer, those weeds grow wonderfully, and weed honey is great. The locusts right now produce a really clear honey that once bottled, it'll darken up a little bit. Weed honey looks dark, almost like molasses when I pull that out from my bees. And I pull off far less, but I got some people who love it, and I got a guy who likes to make mead with weed honey. It's weed from weeds, not marijuana, it's weed from weeds. Asters, goldenrod, and other things like that. So the whole idea of honey is just, it's a really fun thing to do.
I got another question for you. So how do you get around the flu vaccine mandates for healthcare workers?
Well, here's, by the way, this doctor will tell you that if you don't take an influenza vaccine, healthcare workers are mandated. At Premier Health, you're either fired or you take it. And that's just the bottom line. They've drawn a line in the sand. And the reason that is because the feds say that if you want to be reimbursed, you have to reach a certain immunization level that's there. And that's simply because that external influence on the legislators got them to put that into legislation. But if you have others at home who haven't had it, I tell people that during cold and flu season to take extra vitamin D, and they also need to take extra vitamin C. I am a proponent of very high dose vitamin C. So I take 2,500 a day. And then during cold and flu season, if I feel myself getting ill, I double it. Note,
You don't work for Premier Health
I do.
then?
So my group does, so we have to abide by some of their work policies. So sometimes I would say I'm kind of the guy that holds out until the end. Sometimes they forget about me. And I'll tell you, some seasons with 8,000 IUs of vitamin D and 2,500 milligrams of vitamin C every day, washing my hands, and I put a mask on if I go near some people with influenza or influenza-like illness, I don't get it. I don't get it. My kids, they didn't want to take it, so there was no mandate in their school, there was no mandate at my daughter's college, so they did the same. They take their vitamin D and vitamin C, and they didn't get it. So I tell a lot of people, if you're in an area where you don't need to get it, no one mandates you to get it, if you do your vitamin D, vitamin C, practice good hygiene, get plenty of rest, do a little exercise, and eat the right way, your body is well designed to keep itself healthy. Yes?
What's your source of vitamin C?
My vitamin C and my vitamin D, I buy them from a place called Vital Choice. And have you seen Vital Choice? So I get them there. It's from the West Coast, and they were at this Food is Medicine conference.
Oh, they're the seafood company, right?
Yes.
Okay.
Yeah, so they do have seafood.
They had a falling out with Western Price. I don't know about that.
But they were at Food is Medicine, and they've kind of expanded some of their products. They used to be just vitamin D, omega-3s, and then they started getting into custom seafood. Then they branched out into some fruits, and they branched into some meats and things like that. So maybe there was some sort of an issue that came up, at some point related to that. But that's where I get it. But for your source of vitamin D, they're the tops, I think. That's
So
how-
they have capsule.
Yes.
So,
Yeah.
okay.
Yep.
Okay.
Yep. Check their stuff out. I don't work for them. I don't get anything from them, but I like their stuff. All right.
Seafood's okay.
Any other questions? It's good. That was a
So at Christmas time, I got the flu, and it turned into pneumonia, and I went to the hospital, and because of my age and because I have been dealing with some autoimmune things, I had to be admitted, had to go on the antibiotic, had terrible, terrible food. I was so hungry, I just wanted to be home so bad. But if you had your choice and nobody was telling you what to do, nobody over you, what would you have had me do?
You may still need to be hospitalized, okay? So if you probably got a secondary bacterial infection. Once you had influenza, you had a secondary bacterial infection if your immune system was taxed. So that's probably what it was. And the problem therein being is your body's, whether it's viral or bacterial pneumonia, your body's going to respond to the immune system. And when you cough, when anybody coughs, when you cough and you're ill and you bring up that greenish, yellowish, nasty stuff, this is white blood cells are rushing to the area to combat the infection. The problem is in your alveoli, which are the terminal parts of your lungs, it gets plugged up by that. And when you cough that out. But as long as the infection's present, your body's responding to it. You compromise your ability to oxygenate. So one of the biggest reasons we admit people with pneumonia is hypoxia or low oxygen level. So that in and of itself mandates that you go in the hospital. Because you gotta be carefully watched when it comes to your
I think that the
hospitalization.
biggest reason they admitted me was low blood pressure.
So you could have also suffered from, and if you're on an immunosuppressing drug like methotrexate or something like that,
Yeah, I'm doing really well.
You gotta have your family sneak your food in.
Yeah,
Because if they see, if you ask for that, it'll never be there what you want. And then if you tell them what you'd like to eat, say, let's take raw milk, we talk about that a lot. If you want that, they'll ban you from bringing that in. You just have to have somebody else bring that for you and put it in another container and bring it in and just zip your lips and have it. Because otherwise, they would go crazy about something like that. But usually it is, you know, if I was in a mini doc like that, I'd give you a choice and say, look, you know, I need to bring you into the hospital. We need to give you some therapy to keep your alveoli open and to, you know, maybe rehydrate you, things of that nature, which would make you feel a lot better. And if some of your numbers are okay, I'd like to be able to send you home. You know, to the point where maybe you could come into the office the next morning and I could recheck you. Or maybe, you know, in the future, we're working on some projects right now where we're actually, it's not necessarily home care, but it's called community-based paramedicine, where the local paramedics could come out and do a spot pulse oximeter check, and then they can send me a text to let me know you're doing okay. So we're trying to come up with some novel ways to keep people out of the hospital and use different resources, or if you had somebody who was maybe a doctor, nurse, or paramedic, or you know, some other health provider in your family, that they could do that. My worry a lot of times is the people who are unattached. They don't have physicians. They don't have any access to anything. A lot of times when they go out the door of the hospital, they're in the wilderness. You know, they don't have a primary care doc in the community or somebody else they could turn to for help in that situation. To those people, they have 911 and they have me in an emergency department. That's all they have. So there's a lot that goes into your medical decision making. That said, I do like to engage in decision making with my patient. So me, the doctor, telling you, this is what I think you have, and here are your options for treatment. And let's make a decision together. You, the patient, make an informed decision. That's rare. And to allow you to help own your health care, okay? And you're going to ask me, I'm going to give you my best professional judgment and explain, here's what we could do, you know, maybe give you 2 or 3 choices, and then you make your choice. Then our job is to set you up in the best way possible with that. Understanding, if I think there's any possibility that you're not going to live or you're going to have a calamitous event, I'm just going to say, you need to come to the hospital and come in. So that kind of thinking, that kind of teaching is becoming more commonplace in medicine, to be able to give you some choice in healthcare. You might have to sign an extra document. You might have to, not necessarily that AMA, against medical advice document, because you're not doing something against medical advice. I'm not going to make you sign out AMA and make you responsible for the bill. I'm going to diagnose you and I'm going to discharge you because you and I made, or your family that's with me, made an informed decision. Benefits, risks, treatments, all explained. And you get to go home.
Do they give you 10 minutes with the patient, like most doctors?
In an emergency room, I usually have 2. I usually have 2 with you. You come to the ER, if you get a medical student of mine or something, they can spend an hour with you. And some of my colleagues who don't like to take medical students, I'm like, you guys, you shouldn't feel that way, because my patient satisfaction scores are sky high. If you come to the ER and get an hour with somebody in a white coat, you think, what great treatment, I'll come back here. The medical student has a lot longer, because they ask a million questions. Whereas I'm running room to room, you know, I'm going to deliver a baby, and I gotta go take care of a gunshot, and I'm sending somebody to the cardiac cath lab, and so the students a lot of times have much more time. But, you know, unfortunately, the longer I'm in medicine, the less time I get with patients. You know, this is the thing that took away a lot of my time with patients, because I've got a chart in that electronic medical record. And that medical record I have to chart in because it should be a tool to communicate with other doctors or nurses, but it's turned into a billing tool, not a communications tool. So that's another problem with Western medicine. We didn't even put that in the slide presentation tonight. Isn't, you know, that the chart has become a billing tool.
So I think in Eastern medicine, the doctor gets paid on how many people get well.
Yeah.
That's their bonus.
Yeah.
That would be scary.
I took my eye exam for my driver's license,
Yeah.
and it kind of scared me, because I think I see fine, but, you know, that machine is horrible, right? So I went to the eye exam, and I'm waiting for the doctor to come in to get some drops of eyes, and I'm looking at the screen, and I'm like, oh my gosh, they have someone else's chart on the screen, and I can read all about it. This person has this and this, and then it occurred to me, that's my chart. The doctor hadn't even walked in the room, and just because of my age, they put down 2 diagnoses. And he hadn't even seen me.
Oh, my
What a
Lord.
question.
Wow.
I'm never going back, ever, ever.
It increases the complexity of your visit,
Oh.
and it upcodes the charge.
Wow.
And my friend who's an ophthalmologist, she says, yeah, it's forbidden.
Mhm.
And I told him to take it off. He said, but you had it. I'm like, I don't. He won't take it off, and now it's on my permanent record. Some bullshit thing.
Yep,
Sorry, my language.
that's what it is.
Jeez.
So that gives you a little bit, of a glimpse into some of the things we have to deal with in Western medicine. There's good things, there's difficult things to work with. But I think for all of you to continue to educate yourself, to learn and listen and see more, really though, place a tremendous amount of emphasis on, your own choices, your own nutrition. One thing for one person doesn't work for everybody. But there are so many healthy alternatives and options that exist for you. So pay attention to your own nutrition, help other people. Be aware that there are those dietary saboteurs out there, the naysayers. There's still somebody that's going to give your kid lots of M&Ms and dum-dum suckers and Cheetos, and it's tough to deal with. But, like I say, I've seen in my own children, we helped craft the way their palate is when they were little, and they're going straight in that direction now. They're going straight in that direction, and so I'm a firm believer that, especially with young people, if we educate them early and get them used to healthy choices, they carry that on into adulthood. And the proof in the end is going to be, the prevalence of chronic disease in those people. And so I'm actively choosing to take the latter third of my career in medicine and try and reorient toward wellness and health, and take a specific and directed intent to work on wellness and preventative medicine in people, because I'd rather see you when you're healthy and feel good and do things to help keep you that way. Instead of having to worry about putting you in the hospital, I would like to do other things, design other strategies for you to keep you feeling good and active and participating in life to whatever degree you want. Hopefully that would make a dent in some of these horrific chronic problems that just seem to plague Americans in this day and age. So thanks for inviting me.
Thank you.